have no idea how long I've had this cancer because I've been asymptomatic. I've carried on with my life. I've walked 15 miles, 20 miles up mountains, which is what I do with my husband, and I was getting to the top and I wasn't breathless. I had no inclination. And that's what I'm passionate about, that people like me, who is healthy, with no red flags at all, I've mitigated every single risk for cancer, and I've got lung cancer. And I want it out there that if it can happen to me, it can happen to anyone. My name's Julie Sutcliffe. I'm 58 years old. I was diagnosed with lung cancer this year in January on my birthday. Worst birthday present I've ever received. In November last year, I noticed I had some right flank pain. It didn't feel muscular, and being a physio, that's always my first idea. So I went to visit my GP, saw the practice nurse, and she said, "Julie, I think you've got a urine infection." So she put me on antibiotics for 2 weeks that did nothing. And she said, "We'll send you for a renal and abdominal ultrasound. It's clear." I said, "Well, that may be so, but I've still got this discomfort. It wasn't an acute pain, it was a dull ache." She said, "We'll get you in to see your GP." So it was Christmas Eve last year. I saw my lovely GP. My bloods were fine, my oxygen saturations were fine. I had no other symptoms. I had no breathlessness. I had no cough. I wasn't losing weight. I had no fatigue. I was working, just living my normal life with nothing at all that would alarm me to the diagnosis. Which I think we'll send you for a chest x-ray. I had a little bit of palpable discomfort around my lower ribs. So the Wednesday after Christmas, I went for my chest x-ray. The Tuesday following that, I got a telephone call saying, "Julie, you've got a shadow on your chest x-ray. There's no family history. I don't live in a radon gas area. I don't live with a smoker. I don't drink. I'm physically fit, eat a healthy diet, maintain a good weight." So cancer was the furthest thing from my mind. "You need a scan." On Thursday that week, I received a telephone call from the hospital saying, "You have a consultant appointment on Monday." And it was at that point I said to my husband, "This is being done under a 2-week rule. This isn't good news." When I went to see my first consultant, which was in Kendal, he took the decision because my PD-L1 marker was between 55 and 60%, then immunotherapy would be the best way forward for me. So that started on Valentine's Day. So everything so far, my birthday was a cancer diagnosis, Valentine's Day was my first treatment. So from diagnosis to treatment was 4 weeks, and I consider myself very blessed. I think anybody who's diagnosed with cancer wants to know what their options are, and they want treatment to start as soon as possible. I had this idea in my mind that going onto the chemo floor, I'd be surrounded by very sad, very poorly looking people, mostly with no hair. And when I went in, I was pleasantly surprised. It was like so refreshing. The nurses were phenomenal. They had a terrific sense of humour. There was laughter, there was chat. And even though this was between screens because of COVID, I have spoken to some wonderful people, and I can honestly say that in all the time I've been having treatment, I've not seen one miserable person on the chemo floor. I remember that first day, it was February, it was cold, and they struggled to find a vein because my hands were cold. So I sat with hot packs around my hands for half an hour so they could find some veins. I had cannula in, so there's no lines. Literally a cannula in. The treatment takes between 30 minutes and an hour, and then I go home. My lung cancer nurse at the time rang me the day after and said, "How are you?" I said, "I'm fine. I've been waiting all night for something to happen and nothing has. I feel fantastic. I feel fine. Does this mean it's not working?" She said, "Absolutely not. It's great that you're asymptomatic." So I've just had my 10th cycle. The scans show it's working brilliantly on my big tumour, which is now 80% smaller than it was when I started. I think the biggest change in my life is that I'm about to retire. I've decided that after 37 years, I've done my time in the health service and it's time to retire and live my best life. And my daughter keeps saying, "Mum, cancer notwithstanding, you are living your best life," and I am. I'm seeing friends, I'm going out, I'm doing things. My husband and I, we go on holiday, we're making memories, we just make the very most of every day. So life is different, but not worse. Every day is a blessing. I'm looking forward to every new sunset, every new sunrise. I'm looking forward to kicking the leaves in the autumn. I'm looking forward to cold frosty days in the winter. I'm looking forward to daffodils coming up in the summer, in the spring. I'm looking forward to my daughter's wedding. She gets married in December. And it's all stations go at the minute. It's very exciting. I'm a glass half full kind of girl. I always have been, and I see no reason why cancer should change that. I'm lucky because there are treatments out there, and it's not a case of if this one doesn't work, it's last chance saloon. It's not. I don't feel like I'm at the end of the road. I'm at the beginning of a journey.